A chiropractic adjustment is a method of treatment that I use to bring the body back into balance. Misalignment or an imbalance in the body can manifest or show up as stiffness, as achiness. It can show up when you wake up in the morning and you get out of bed and you're just not as mobile as you once were. It can show up as headaches. It can show up as a lot of different things. And what can happen through time is if these areas that are off balance go untreated, they can develop further into more serious problems. So what I do is I examine the body from top to bottom, looking for areas of misalignment or imbalance, and I use what we call a chiropractic adjustment, or better put, a rebalancing of the spine. So if you can imagine a door inside a frame, and we've talked about this before, that door is lined up inside the frame and it's working and it's very smooth, then that door is in balance, or you really don't need to do anything to it. But if you've walked up to a door, and I know a lot of people have, and you go to open the door and it's hard to open and it sticks and it's really hard to do. What was once easy is now harder to do. It takes more effort. It's more stressful to open and close the door. So the same thing can happen in your body. Stress, emotional upheaval, accidents or injuries can cause the body to go off balance, just like that door goes off balance. And what you would do to treat that door or to fix the problem is you do an examination of the door, or you evaluate the door. You evaluate the frame, the door, and you find out where that door is sticking, or if one of the hinges has come loose, and you adjust it. So you make a change in it so it can return to balance more easily. And that's exactly what a chiropractic adjustment does with the body. What I do is I check your body from bottom to top, top to bottom, side to side, front to back, for any areas of impingement where things have become restricted, just like that door is. And then what I do is I use the activator, which is this instrument right here. And this instrument delivers a very specific impulse. There's 4 levels on it, at a specific angle, at a specific joint, muscle, or tendon to bring that balance back into the body. It makes very, very subtle changes, but enough subtle changes to make a difference so you can get a restoration of movement, pain relief, reduction of a radiculopathy, which could be a pain going down into your arms, into your hands, or into your legs. So a chiropractic adjustment is a rebalancing of the body, just like you would rebalance a door. Another analogy would be the alignment on the tires of your car. When you get new tires put on, what they do is they look to make sure that when you turn your tires to the right and to the left, when you come back to center, they are lined up. Now, the issue with chiropractic adjustments is you can go your whole life and never have a chiropractic adjustment. And you could live a full life, but do you want to feel better? Do you want to have mobility? Do you want to be able to get up in the morning and move easier? If you do sports, if you're active in golf or anything, do you want to be at the top of your game? Just like an alignment on your car's tires so it drives smooth and is easier to navigate down the road, the same thing with your body. And that's the most important thing. A lot of people think that you go to a chiropractor for an adjustment when you're in a car accident, or if you have bad back or a bad neck. Well, that's not exactly the case. Anybody can benefit from a chiropractic adjustment to make sure that all the joints are moving fluidly and all the muscles are tracking like they're supposed to. So who would want to go to a chiropractor? Anybody that has a spine. One of the questions that people ask is, if you go to a chiropractor, once you go, do you always have to go? And the question is, no, you don't have to always go. I know a lot of other doctors that have that same motto. There's, what do they call, dentists? Oh yeah, dentists. You go to a dentist and they say you need to come back every 6 months, or some people need to go back every 3 months. Well, that's a rack. Why do they keep doing that? Well, it's not necessarily that. They want to make sure that your oral health is up to par. So you can never go to a dentist and live a full life. You may not have a bunch of teeth left, or you could be one of those lucky ones that never goes to a dentist and you have great teeth. But most likely, the protocol that's put in place is for our benefit. So I have a lot of patients that do come in and they like to get adjusted or get treated once a month or once every 3 months, just to keep their body in balance. If you live the perfect stress-free life, you probably don't need to go to the chiropractor. Are you lying on a beach somewhere where someone's walking around with trays of drinks and cookies and stuff, and you don't even have to get off your hiney to do anything? Well, most of the time, we're not living in that society. So could someone benefit from a chiropractic adjustment? Absolutely. Chiropractic problems start generally gradually. You have some sort of stressful experience sitting at a computer all day, driving in a car all day, improper posture all day, doing a repetitive motion, or having some sort of stress, which can cause your body to go off balance. And the imbalance will show up generally as a stiffness, random stiffness that starts here and there and then gradually increases until it becomes a pain. And then it's usually a localized pain, which is a pain somewhere, for example, in the neck or the low back. It's kind of hurting. I rub some stuff on it, or I take some pills, or I go get some creams or lotions and I rub on it, it feels better, but then it comes back and then it's gone for a week and then it comes back. And then eventually it becomes a more severe pain. And if the nerves become affected, then you start getting pains down into your arms or numbness down into your arms and down into your legs. And those are the conditions that I can help with. It doesn't matter at what level you're at. If you're just at a mild stiffness, I can help. If you're at the other end where you're having pain down into your arms and legs, I can definitely help. And the way I help is by looking at the body as a whole and checking everything and making sure everything's in balance and delivering a chiropractic adjustment, which is finding which way that joint or angle is impinged, and then we go the opposite way with the activator to make a change within the joint. So a chiropractic adjustment, simply put, is bringing balance back into the body, just like you would adjust a door inside a frame so it opens and closes, just like you would adjust or align the tires on a car so the car can track more smooth. Is it something that everybody absolutely needs? No, but could everybody benefit from it? Absolutely. Do you live a life in our society? Yes, you do. Well, you could probably benefit from a chiropractic adjustment.